evening from 7 till 8. You're listening to Our NHS, Our Health. This is a show where we'll be talking about the NHS and how it impacts on our lives and what's happening in Leicester and Leicestershire with our health services and how we can improve our children's health in this particular case. And we've got quite an eminent expert in the field who's come into the studio, and we're very grateful for that. You're listening to Radio FM 87.7 FM. This is Radio Ramadan, and the phone line number, just in case you want to ring in on any of these subjects, is 0116 482 2086, or you can text us on WhatsApp 07748 855 055. It's a bit funny this year for me, really, to be honest. I've just come back from Umrah. I've got a special Umrah cut, which is very short, and I keep thinking about I need to comb my hair, and then I remember I haven't got any hair left because I've just come back from Makkah and Medina, and it was a really peaceful and serene time for about the 7 or 8 days that we were there, and I thoroughly loved it, and I think I can recommend it to anybody to go when they've got any time. The visas are open. It's a great place to visit, and make sure that you do your Umrah and be able to pray at the two most holiest places in the world, really. It's also a bit weird because the Rosa is open, the fast is open, and I've never done a show where the fast has been open. Normally, I'm here with the fast and waiting for iftari, and on this occasion it's already open, and I'm here with a glass of water and enjoying it, which is great, fantastic. And I think Ramzan is going to go particularly quick this year because they seem particularly short. It's very quick for us to be opening our Rosa at about 7 or 8 minutes past 6. It's very, very early. And let's hope we have a great Ramzan, and I hope everybody is enjoying Ramzan and going to enjoy the holy month and make sure they pray plenty and make sure they go to all the namazes as well, which I'm always trying to do as well, inshallah. We're joined this evening for our show by Dr. Damian Rowland, who's the head of Leicester's Children's A&E department. He is a paediatric consultant, intensive A&E consultant. Am I correct? So can we have first of all, can I say thank you very much for coming in, Damian? The fact that you work for the NHS, you're automatically one of our heroes because I just feel that the NHS is such a valuable organisation that takes care of us when we're seriously critically ill and takes care of our children when they're seriously critically ill. And I just wanted to say thank you on behalf of listeners, because it's very rare that we get the chance to say thank you to people. But you and your teams do a fantastic job. So thank you, first of all, and welcome to the show.
Thank you very much. Thank you for those kind words. I mean, I'd like to thank the public of Leicester, actually. It's been an incredibly difficult 4 to 5 years since COVID. We asked a lot of the public, actually, and they've responded by and large immensely well.
That's great. And Damian, how have you ended up as the person in charge of Leicester's Children's Intensive Care Unit? Was it something that you ever imagined? And it's such a busy unit.
Some may say I'm glutton for punishment. I have always enjoyed being a paediatrician. I've always enjoyed paediatric emergency medicine, mainly because children become ill very quickly, but they become well even quicker. And I enjoy watching children become better in front of my eyes in the emergency department. I also think, I hope I have a lot to offer in leading children's emergency services in Leicester and actually nationally, in a way that enables families to seek solace in wherever they go, whether it's your GP or to the urgent care centre or to the emergency department. What I'd like to happen is at the darkest moments of a parent's lives, because it just feels like that to sometimes, that they're getting compassionate care.
And you deliver on that. And I've been in there with my children in the past, and the care that they give, the teams, the nurses, the HCAs, the whole sort of NHS family, they look after people as a family, and it makes a huge difference to lots of people. Do you feel that when you're doing that actual work?
Yeah, anyone who works in healthcare, I think, thrives on the special team spirit that we have. And certainly in emergency medicine, we are a team. There's very little hierarchy, but whether you're a cleaner, HCA, nurse, doctor, manager, we are all trying to do the same thing. And I absolutely love the spirit that we've embodied especially in the emergency department.
I was lucky enough to work for the NHS for about 4 or 5 years, and I had one of those NHS lanyards, and I loved it. It was part, I felt like I was at home all the time, and it's a wonderful feeling, and it's a huge honour for me to have worked in the NHS for those few years. But how does it feel as a doctor working there? I can imagine it gives you a buzz.
Yeah, it does give me a buzz. I mean, we have to be careful that it's a challenging job. And what I probably enjoy most is when families, carers are at their worst ebb, that we can make those things a little bit better, or certainly when tragedy occurs, that we're not making things worse.
Exactly, and that's a fantastic part to be playing, really, to be honest. How many patients do you actually see at Leicester's hospitals for the children's department?
Yeah, so we're now seeing 68,000 children a year.
Wow.
And it actually just shows you how things have changed, because when I came to Leicester in around 2008, we were probably only seeing about 35,000 children. So, I mean, we've nearly doubled, such is the demand for services now.
That's a huge increase, isn't it, really, over those years? And so what is the biggest challenge at this moment in time? What is the thing that's worrying you and people coming in with? We know there's a measles outbreak across sort of parts of the Midlands. Is that affecting what's happening in the hospitals?
I think there's three things to consider. So there are health concerns themselves. So we have a busy winter season of respiratory viruses. I know we'll talk about that. We currently have a challenge with measles, and we'll discuss that. And there's always something cropping up. But the other two big things are, and I would like to touch on these, is families and carers' expectations have changed. One of the reasons we're seeing more children now is because I think the tolerance of minor illness has decreased. I don't know if that's because of changing families, some of the concerns that came out of COVID. And I think one of the things that we can do brilliantly in the programme is demystify some of those minor concerns. But the other thing is, and we have to acknowledge the impact of inequality. Yeah,
it's there because I was looking at the figures. The city is almost 40% of child poverty. It's astounding. The figures are absolutely horrendously bad, and that is a huge problem for people, isn't it?
The biggest driver for presentation to the Children's Emergency Department is deprivation. Yep. And it doesn't matter which ethnicity or culture you're from, it is deprivation that drives demand.
Deprivation that drives demand, and that's not a very good position to be in, really, because it doesn't look any easier just looking forward, really, to be honest, either. So we're going to talk about measles. So what's been happening with the measles outbreak?
Yeah, so it is really sad. A decade ago, we are declared measles-free by the World Health Organization. We have essentially eradicated a disease, and sadly, because of slow uptake of vaccination, we've had that status removed. And over the last couple of years, we've seen increasing rates. Sadly, in the Leicester area, only about 85% of, in some areas, of children have been immunised. And when you go back...
Is that not enough, though? 85% is not enough. It needs more than that, basically.
Yeah, we need more than that. We need to be above 90, and we'd like to be at 95%, because if you can get to 95%, then what you can do is you can protect those children who can't be immunised. And I don't think the public always realise this. There are children out there with immunodeficiencies or problems which mean they can't have the vaccine, even though their parents might want them to have it. And what we need to do is protect them from measles, and we can do that by other families doing their part by getting their children immunised.
So you need that 90% coverage before it actually becomes effectively.
Also that we can stop spread in its tracks.
And what have you been seeing at Leicester's hospitals, and what is the advice you'd be giving to parents out there?
Well, we need to be really vigilant about measles. Measles is a disease that causes you to be unwell, cough, cold, runny eyes, and have a fever. By and large, you will recover from it. So I don't want to scare people. It's not as if measles is always a deadly disease. But sadly, we do know a proportion of cases become very unwell with a chest infection. And in a very small proportion of cases, you can get swelling around the brain, which can unfortunately be fatal. And so we've seen really nothing like that, but we are seeing cases present of children with fever, coughs, colds, a bit of their fluids. And it's not, we're not seeing hundreds of cases, but we're seeing enough to know that in the community, measles is spreading, and there is a public health challenge that we all have to ensure that all children who can be immunised are immunised.
And what's the biggest thing that's stopping these people being vaccinated from measles? What do you think is the biggest thing? Is it just fear of something that they don't know?
No, I think that the public as on large actually want to get their children vaccinated, and they've not been affected by some of the fearmongering. It's just access. We've had a really challenging time reaching people. We've just discussed that we have a challenge with deprivation, and I think it's just getting children to where they can be vaccinated.
So your advice would be to the listeners out there is please make sure you get your child vaccinated. Chase down your GP, maybe chase down your nurse and make sure that they get vaccinated.
The GP is the best call of point of access. Go and see your GP. Say, look, I'm worried about my child. They've not been vaccinated, or let me know if they've been vaccinated, and they will sort something out for you.
That's great. Yeah, you're listening to Radio Ramadan on 87.7 FM. Our phone line number is 0116 4822 or you can WhatsApp us on 07748 855 055. I'm here with Damian Rowland from Leicester Hospitals. He's the children's A&E department consultant, and is talking about measles. If you've got any questions on measles or anything else to do with children's health, he's here to answer those questions. So please reach out to us, and we'll try and get those questions answered. What can people do? What can people do when they come into hospital to make it easier for the staff there? Because, sometimes it's a very busy unit, lots of people in there. How can people be helpful to you?
Yeah, so the important thing is that any child under the age of 1 won't have been immunised, because the immunisation schedule doesn't start until you're a year of age. If we have a really busy emergency department waiting room, and we have lots of children under 1 there, and we've got a family who may have a measles case, there is a risk of that measles spreading in the unvaccinated group. So we're really trying to reduce the amount of people in our waiting room for their own safety, really. So we ask, if you're coming to the emergency department, please try and just bring 1 carer with you.
Yeah. So or the child that's ill, and not any of the other children, effectively.
So please try and avoid bringing siblings, because we don't have the space for it, and you are risking kind of spread of disease. Yeah,
that makes sense. It really does, because it makes your job easier. And as you said, you're a 68,000 patients per year unit. It is a very, very busy unit. That is.
On Monday, we saw nearly 230 children. Yeah. So that makes the waiting room, especially in the evening, extremely crowded.
Right, excellent. You were talking about measles, and there's one sort of the fever factor. There's lots of people who'll say, our child has got temperature, what should we do? What's the advice? Because that's lots of calls to 111, lots of calls to their GPs. They're worried because the child's got high temperatures. What's your advice on that? And you must be seeing lots of people coming in with that as well.
Yeah, fever's really interesting. There is a lot of fever phobia out there in the community, mainly because...
So people are scared of just the fact that their child's got fever, and you think that triggers something else to them.
It's really interesting. So my message to all parents and carers is, please be alert to your child rather than their symptoms. And fever's a great example of that. So you've got a little one who might be 18 months old, is toddling around. They've got a fever, but they're happy, they're playing, they're eating and drinking. But there's a lot of concern about the fever when the child themselves is completely fine.
Normal, yeah.
And we're not quite sure where it comes from, but I think because of maybe stories people have heard in the media, stories they've heard from their friends, there's an anxiety that this fever must go away. But what's really interesting is the fever is from the body. It's not from the virus or the bug. It's the body raising the temperature to get rid of the virus. It's a good thing. Yeah. There's actually some evidence that if you don't treat the fever at all, the disease lasts shorter because the body deals with it quicker. The key message for me is what you want to do is treat your child's distress and not the fever.
So you're treating the distress, meaning calm them down or whatever it might be in the case?
Well, I think every parent or carer knows when their child is miserable with a fever. We've all had it. You feel headachy, you feel rubbish. The clingy child, the one who's crying and miserable.
And those are those things that you would then say, you need to do something when that happens, basically.
Yeah. So if you've got a fever and distress, we're compassionate. You want to relieve that suffering, so you can give some paracetamol or ibuprofen. If you give paracetamol or ibuprofen when you're playing around and you're well, it's not doing anything.
No.
And then you can't use it when they do become distressed.
Yeah. And there's lots of things about the costs of quite a lot of these children's medicines. And I know we've done some research in the past. So people can use the unbranded versions of paracetamol, and it's far cheaper than the normal branded versions.
I would love people to only use unbranded versions.
Yeah.
There are some very popular brands out there.
Carpol and several others, yeah.
And they don't do anything different. There's nothing special. There's nothing magic about them. They're just paracetamol.
And actually, if people are on a budget, we talked about deprivation, we talked about the cost of living. Those drugs are far cheaper than the branded ones, and it's the same product inside, isn't it? There's no difference.
No difference at all.
Yeah, and that's across the board on quite a lot of the medication. You don't always need the brand names. Look at the ingredients and make sure it's the same. Ask the pharmacist, ask the shop that you're in, and you will save a lot of money, won't you?
Yeah, and I think you are out shopping today.
Yes, I was. Yes,
you can get like half price, maybe 2/3 off the price.
I use a medication for an allergy that I have, and if I buy it with a brand, it's something like £6 or £7 for 30 tablets. But if you buy it with no brand, but the same chemical formula and the same results, everything else is the same, it's 70 pence. So there is lots of money to be saved. And actually, I think one of the things that we were discussing sometime before was you can actually buy some of these medications and keep them in the cupboard, and you've got them. Because the worst thing is when you go out in the middle of the night trying to find something and try and buy something, you pay a lot of money, number one, and number two, it takes a lot of time.
Yep, definitely. And that be prepared policy is really important. So I often tell families there is lots of information out there on dealing with a fever, dealing with breathing difficulty, dealing with diarrhea and vomiting, but you don't want to be looking at it or for it when your child's unwell.
Yeah.
Try and find the information beforehand.
Yeah, so be forearmed rather than
definitely
anything else. Respiratory disease, coughs, colds, and breathing difficulties. So, how many children do you see of that, and what's the best advice you can give on people whose children struggle with breathing?
So the biggest presenting complaint to our emergency department is fever and breathing difficulty. Now, I think I'd put it into two categories. So there's breathing difficulty in the child who's less than one, and breathing difficulty in the older child. For little babies, there's a virus called bronchiolitis. It's very common. Virtually everyone gets it. And it gives you a runny nose, bit of a chesty cough, bit of breathing difficulty. By and large, though, all those children will get better over 3 to 5 days.
That's the symptoms, and they'll get better on their own without any
with no treatment at all.
No treatment at all.
You might get a cough for a couple of weeks afterwards, but that will go away. The key thing is when you're little, is how much you're able to feed. So it doesn't really matter. Parents get concerned about the work of breathing, but actually if a baby is able to feed regularly and having regular wet nappies, what that means is their breathing distress isn't severe enough to stop them feeding.
So the two things that you'd look out for is actually feeding and wet nappies. So if they have the feeding and the wet nappies, it's not too much to worry about.
No.
Okay.
And you can have actually quite a lot of the indrawing, but if you're feeding well, you'll tolerate that. And it's a little curve, basically. You go over a hill with bronchiolitis, 3 to 5 days, and then you'll start getting better again.
And the second category?
Yeah, so I think asthma is a big thing, and especially in a place like Leicester, where unfortunately it's about deprivation and poverty.
Is it something to do with the fact that we're dipped in that's one of the theories that I've heard in the past?
Yeah, it's an interesting thing. We know that there's increasing awareness of pollution. And sadly, if you live in a crowded city, that there's a lot of smoke and smog, that the living conditions can have an effect. The big thing is regular preventative treatment and understanding your child's asthma, knowing about inhalers, which inhalers to give them when. But for the older child, then their breathing difficulty does become more important. And I think parents who are experienced with their children will watching for some clear telltale signs. So it's looking at the top of the rib cage and looking at the skin being sucked in. Yeah. That's a sign of moderate breathing difficulty, and that's when you need to consider getting some help.
And what would you recommend? Where should they go? Should they dial 111 or go to their GP or go to A&E? What's the first port of call for them, really?
First port of call should probably always be 111. I appreciate sometimes the waiting times can be long, and sometimes phoning them back can take a time, but it is an expert service, and they will give you the advice that you need. They will do one of three things. They will tell you, actually, this is okay, here's some advice. They may suggest that you visit a general practitioner, and they may be able to book you an appointment to do that. And if they do believe that the child's really unwell, then they will suggest you go to the emergency department, and in severe cases, we'll get an ambulance for you.
Yeah. Okay. And we're gonna be coming back after the break, and we're going to be talking about vomiting, diarrhea, head injuries, and then the topical subject of vapes. We'll be talking about all those subjects. You're listening to Radio Ramadan on 87.7 FM. Please, if you've got any questions, you can text us on 07748 855 055, or you can call us on 0116 4822 086. You're listening to Radio Ramadan on 87.7 FM. Hi, good afternoon. You're listening to Radio Ramadan, 87.7 FM. Assalamu alaikum. My name is Zuffar Haq. I'm hosting this show, which is the Our NHS, Our Health. I'm here with Dr. Damian Rowland from Leicester Hospitals, and also here with Zuffar Haq, who's a 17-year-old who we're going to be talking to later about vaping and why children are vaping across the board at the moment in Leicester and Leicestershire. Damian, we were talking about the sort of main things that are coming into the hospitals, children coming in with different illnesses and issues. Vomiting and diarrhea was next on the list. Do lots of children come in with vomiting and diarrhea, and is that a severe problem here?
Yeah, it's a really common problem, and it causes a lot of anxiety. And I can understand why. It's not fun to see your child distressed with vomiting, and parents and carers often get really concerned that their child's not taking enough fluids in. So there are a couple of key factors here. So the first is especially for babies, parents and carers, and I'm sure you'll have done this, when you change a nappy, there's a reflex. No one tells you to ever to do this, but you weigh it in your hand.
Yes.
It's an instinct. No one teaches you it, but you do it. And what that tells you is how much urine your child's produced. If you've got a heavy nappy, especially a nappy, if you roll it up in a ball and you chuck it across the room and it hits the wall with a thud, that's a good nappy. It's got enough urine in it. Even if your child's had a lot of vomiting and doesn't appear to have had much fluid, that means they're well hydrated. Don't get too concerned. It's when you feel the nappy, it's got nothing in it. If you try and throw it, it just goes all over the place. Then that means that your child isn't producing enough urine, and it starts time to think about, are they taking enough? And the key thing, especially for a baby, is they must produce urine every 12 hours. So if you can, a couple of wet nappies a day, that's okay. But if you go 12 hours and it's completely bone dry, then seek some help.
And the vomiting, because they're obviously not keeping anything down, so they're not...
Well, yes, it might appear that way, and clearly some children have huge vomits, but what comes out is often not as bad as you think.
Okay.
And so your child may have had 6 to 7 multiple small vomits, and you may think, oh my God, that's all the fluid that's come up. But actually, it's not the case.
It's not the case. Okay. And how do you generally treat them if they are, what's the best sort of guidance you give?
Well, to me, it's giving fluids, but little and often.
So not big portions, smaller sort of volumes.
I mean, with a syringe, with a spoon, just let them sip on a cup. But if you take, I don't know, a whole Coke can size of fluid,
300 ml,
you're going to see it all back again almost instantly. The other thing is try to avoid not just water. If it's just water and you only have water for 24, 36 hours,
it's not good for you.
It's not good for you. It's the only time that you're allowed to have a bit of kind of sugar in your, have a non-sugar-free juice. There's something called dialyte or other oral rehydration solutions which have got a good amount of sugar and salt in them.
And they're quite useful. I mean, I take them for my kids on holiday sometimes because you never know when you're going to sort of need that. But they obviously work really well, don't they?
I mean, they're designed to be perfectly in balance. So the moment it gets into your stomach, it's absorbed. And actually, it's about the vomiting as well. You can have quite a bit of oral rehydration solution. You might vomit 5 minutes later and the parent goes, oh, they've absorbed nothing. But actually, it's almost instantly absorbed.
Oh, right. So it's very quick.
It's very quick.
Very quick, yeah. So even though you imagine that you've not actually done anything, you've actually achieved something by just going down and it's just got in touching there is enough.
Yeah.
Wow.
And you know that because if your baby's having wet nappies, then that means something must be getting through.
Something must be getting through. And most shops sell those kind of things, so that's what you would recommend. And how do you end up... do people come into hospital and are admitted for something like that or not? Yeah,
well, to be honest, we have something called the rotavirus vaccine now that all children are given, and we've seen a huge reduction in admissions with gastroenteritis. Children who are admitted with diarrhea and vomiting now often have other problems, so that they've got other disease processes and they can't tolerate it as well. It's quite unusual now to have a normal, healthy child have to be admitted just with DMV.
DMV, okay. Unless they're travelling abroad or... abroad.
Something more serious
something
going on,
more
perhaps.
serious, yeah, okay. And then we're coming to the topic of head injuries. You can always imagine all kids have head injuries at some stage in their life. So what's the advice that you would give to people with children who have head injuries?
So people panic a lot. And the big thing is that the concept of sleep. And there's this myth that goes around that your child can never be allowed to go to sleep. And these poor children come in, and every time they're nodding off, the parent wakes them up. After a simple bump to the head, some children are a bit sleepy. What we're worried about is when you can't be woken up at all. And so if your toddler bangs their head, it's just a simple bruise. It wasn't from a big height or anything. They should have some painkillers because that will help with a headache. And if they want to sleep for a bit, they can. You should check on them every half an hour to an hour. Check that they are rousable. But if they are, actually they will be much better after that sleep rather than being kind of kept awake. And the other big thing is vomiting. If you have a lot of vomiting after a head injury, you need to seek help because that is
that is one of the things that you should straight away seek help.
Well, if you've had a couple of vomits, the problem we've got though, and this is a really interesting kind of amalgamation of real life and evidence, is that children who have gastroenteritis, DMV, there's some fear that they get a bit clumsy.
And they can knock their head.
And they knock their head. And we see lots of children who have a head injury but are vomiting because of a stomach bug.
Right, okay.
But it's difficult for parents. If your child has had 3 to 4 continuous vomits in the hour past a head injury, they probably should be reviewed.
They should be reviewed. And again, they go through the same sort of process, 111 GP, or if they're advised, they go to A&E department. Your department's obviously 68,000 people coming in, children coming in every year. Is absolutely huge demand on the staff and everybody else. And we've picked out some of the main sort of key reasons why people would end up in the A&E department. Is there any others that you find that think, oh, actually, you know, we need to keep an eye out there? There's lots of other illnesses out there that you're obviously monitoring for on a continuous basis. Yeah,
so, I mean, children get tummy pain. We've not talked a lot about that, and that causes a lot of anxiety for families. Most tummy pain resolves. It's very rare that children end up with appendicitis or something more serious. And the big things are about whether that pain is relieved with simple painkillers. The other thing we've not talked about is mental health. And we're seeing a huge rise in children with a variety of mental health problems. And we've seen a huge increase post-COVID. And it's challenging in the emergency department because we're not always the right place for a child who only has mental health problems.
I mean, I think screen time, kids on the mobile phones just non-stop, that must add to their mental health because they're not actually interacting with anybody, are they?
Well, I mean, the amazing thing is, and it'd be interesting to see your son talk about this, when I was a teenager, we didn't have WhatsApp or social media. And this demand on your time and expectations is completely different now, I think.
Actually, this is probably a good point to bring Zian in, who's my son, who's 17 years old. Zian, how do you think that people have changed? Because mental health is a big issue for lots of young people now. And is it driven by social media? Because there's lots of, you know, every young person's on the phone when I see them.
I think with young people nowadays, there's a lot of pressure on social media, so I think it also ties into the vaping thing, because a lot of people, when they see someone else vaping, maybe someone that they follow on social media, maybe a big influencer or something like that, a lot of them think that it's kind of cool or it's trendy to go and buy a vape, and then this is what kickstarts this whole kind of chain reaction for everyone, because if you see your friend doing it, then you might want to do it as well, and it kind of goes from there. So I think social media has a really big impact on, like, especially on mental health, but not only mental health, but also like other things like vaping and those kind of things. Social,
antisocial, yeah. You're listening to Radio Ramadan on 87.7 FM. Our phone line is 0116 482 2086, or you can text us 07748 855 055. We're talking about vaping. If you know a family member that's vaping, or you want any advice on vaping, please call in. We're talking about vaping now. It's a big issue, so let's have a listen. Damian, what's your take on vaping? What's happening on vaping and people coming into hospital? Because actually, how old do you see those children too? Is it 18 or 16?
Yeah, I mean, it's probably even younger. It's a real shame because we've had a huge problem with smoking. We've done a lot of work to reduce smoking in younger people, and I think the reason why vaping has caught people by surprise is because it was sold as a way to get people away from smoking. But for children and young people, you see influence with it. It's become a cool thing to have, and the marketing of them is very subtle. These things aren't just black. They're colourful, they're shiny, they're bright, they're exciting, and they're marketed as exciting tools because of the way it attracts a different audience.
So effectively, we've swapped the smoking for the vaping to the younger people.
Yeah.
And you know, I remember, and you probably remember, 20, 30 years ago, 40 years ago, all the packets of cigarettes were always, you know, something different. They look different. They look kind of, you know, friendly and cute and everything else, but they weren't, because they were selling you something that was actually no good for you.
Extremely harmful. And what we did is we locked them away. Yeah. We put warnings on them, and that's the problem with vaping, is that there's now been this amazing advertising, very subtle by these companies, but to get people interested. And it's a shame because vaping itself can be dangerous. So lots of case reports of problems with the devices themselves. But more importantly, they lead a child or a young person down a pathway that they might not expect to be on, and that may promote smoking. And we don't really know the long-term consequences of vaping either. It's a very risky business.
Is that because... Oh, sorry, I'm just going to read a message. Said is saying, thank you. This is a really interesting topic. Thank you. Thank you, Said, for listening. So basically, you know, we don't know what the outcomes are these, because people haven't been vaping long enough. If that's what you're saying.
Yeah,
so because they've not been vaping for 30, 40 years, we don't know what the consequences are going to be.
No. It's as simple as that. This is really untried, untested.
So, Zian, how many people do you think out of 10 between the age group of about 12 and 16 or 17 are actually vaping that you can think of?
So I don't know about actively doing it, but I reckon in about 10 people, at least 5 have probably tried it in that age group. But I'd say maybe 3 out of those 5 actually continue to do it, and then 2 might just try one off or something like that.
Yeah. And how long do you think they vape for? You've seen probably some people around. How long do they vape for? Do they vape for an hour a day, 5 minutes or 10 minutes, or is it quite a lot longer than that?
I don't think it's really there's not really a set time. I think it's more of people do it when they're in a social setting, or if they just sitting there and they have nothing to do, their first instinct is to pull out a vape and just sit there.
Yeah, it was a social thing. Cigarette smoking was a social thing, and that's how it sort of took off. We've got a question come in. Can you get popcorn lungs from vaping?
Yeah, so you can.
And what is popcorn lungs?
Well, so there's a number of. I think what that person is referring to is longer term damage to the lungs, or what I think I'd call emphysema, or breakdown of the lining of the lung, or that you can get problems with kind of other disease processes. Yes, there isn't the amount of tar and some of the damage in these, but what we do know is if you're inhaling any chemical over a long period of time, that is it's designed to be inhaled into your lungs.
Yeah.
And if it's not air, it can't be good.
Yeah. So it's a damage to your lungs straight away.
Yeah. I mean, I don't want to overstate things and say that you have 2 vapes and you've caused yourself a long-term lung damage, but we really don't know about some of the long-term consequences. It's amazing, young people nowadays. So alcohol consumption has just plummeted. There has been a massive cultural change in children and young people to move that way from some habits that in our generation...
Even cigarettes. There's hardly anybody smoking cigarettes, but they're all vaping.
Yeah, and it's the thing to do, basically, but it isn't without risk, and I think it is inherent on parents and carers to have these conversations with their children. It's surprising how many family members will go, there's no chance in a million years that my child would do this, and then they wander around a corner one day and find them with all their friends.
Yeah. And Zian, how difficult is it as a young person to say no, I don't want to do this, when all your friends are doing it around you? And is that difficult? And do people do it?
Yeah, so I think with me, I found it quite important that literally from the minute that I meet a new friend or meet a new person, I kind of set that boundary, because a lot of the time, even in such a normal environment, like going out to play football or going to get food or something like that, you'll get offered it at least once or twice, because it's so normal for people to just, it's kind of like a thing, they pass it around, they all share one, things like that. So it is really easy to just end up trying it one time, and then from there it kind of just leads on from each other.
And Damian, how many people have you seen coming in with lungs issues at the A&E department? I know certainly in adults there has been quite a few, and there's more and more coming through with more younger people.
I mean, I think I'll be honest, it's not a big problem that we see within the emergency
because you're seeing
people, because we're seeing kind of
younger
acutely
people.
unwell with disease processes. Do we have a record of how many of them are vaping? We don't, if I'm honest. But I do know vaping is more, I think, of a social issue. It's a bit like this social media.
Yeah.
It's for children and young people to be aware that this is not a risk-free activity, and especially for vaping, it's to not be drawn into something that is made to look more exciting. And that's why the Royal College of Paediatrics and Child Health have done a lot of work with the government to stop its sale to young people and stop its advertising.
So they've already stopped it, haven't they, really? Yeah. And it's going to carry on. Unfortunately, vaping is a step to shisha, and lots of people do shisha. Lots of people across Leicester do shisha, more than probably most other places. Do you see many people coming with the shisha? You probably don't as children, but there is a serious issue with shisha smoking in Leicester and the respiratory conditions causing that.
Yeah, I mean, and I think if you're ever smoking a substance which has some toxins into it, over time that is going to cause you problems, especially if you've already got other issues. And I think there's this difficult balance between not becoming a nanny state and directing what people do, but allowing people to make some sensible choices about once you start becoming addicted and it becomes a habit, that's when you run into problems.
And Zian, do you think some of your friends or some people that you know would be addicted to vaping now because they've just been doing it for so long?
Yeah, I think there's various people that I know that are actually addicted. But another thing is that many of them think, oh yeah, it's just like something I can stop whenever I want and things like that. But when you look at it, in actuality, I don't think they would be able to stop just like that, the way they say they can.
There's a nice little test we use, mainly for alcoholics. It's called CAGE. And if you ask someone, have they ever thought about cutting down? Have they ever been angry when someone's challenged them? Do they ever feel guilty? Or do they sometimes, it's called an eye-opener, or do they need to use it in a hurry? And actually, if you score on any of those, it does indicate that actually you might have a bigger problem than you think you have.
Yeah, definitely. And Zian, do people move on from vaping to shisha? Because lots of people now do shisha, don't they, as well?
Yeah, so I think the thing with vaping is that it's very easily accessible to the younger ages. So then what we see is people, when they get to my age and even older, they move from vaping to shisha because they have that as well that's accessible to them, whereas the younger ages is I would say it's more difficult to get any access to shisha. But with vapes, it's literally you can go to. Yeah,
I mean, you don't see anybody walking around with a shisha in their hands, but you do see people walking around with a vape in their hands.
Yeah.
But once you become into the shisha realm, it's almost like a shisha cafe, and it's like a social event. So people turn up at the shisha cafe to see their friends and have a chat and watch TV and have desserts and everything else, and that is becoming part of the culture, unfortunately. And it has to change because it has to go backwards the other way, really.
Yeah, and I think with many things in life, these things come on gradually. People don't notice the cultures are changing, and then you're behind the times. And the people waving the flags are often, oh, shut up! You're making too much of a big deal of this. But I think we are in a situation, certainly with vapes, where we've been caught off guard. We should have been having these conversations 2 to 3 years ago.
Wow! So we have been caught off guard. We've not realised this. This has crept up on everybody, hasn't it?
Yeah.
And do you think that's Zian as well? Do you think it's crept up on people without realising that so many people are doing it?
Yeah, so I think I first realised that a lot of people were vaping maybe even longer than that, maybe even 3-4 years ago. So I think the fact that it's taken this long to have serious conversations, especially with the government and the way that people advertise it, I think it is almost it's too late, because the fact is that so many children and so many people that are under the age of 18 have already been addicted or they're almost too far gone and have already been led down that pathway before we've even been able to have the conversation with them.
That's a really interesting point and a sombering point, really, to be thinking about that. But we are here to help, and I think the NHS is doing whatever they can, and it's good to be able to talk. And I would sort of advise that people talk to your children, talk to your relatives, and talk to them about vaping, and just so that people understand, because it's not cool to be vaping. It's not cool at all, and you hear about smoking, and smoking was the same 40, 50 years ago. Now all of a sudden everybody's thinking, oh no, it's really dangerous. And this same is going to happen with some of the other things like vaping and shisha and everything else. So we just need to be always ahead of the curve. I just wanted to say, a big thank you to Zian, first of all. Thank you very much for Zian for coming in and talking about vaping. It's really good to have a young person's view, and real thank you to you, Damian, for coming in and talking about what issues are facing the children of today, and what the hospitals are doing, what you and your team are doing. And again, I really wanted to say thank you on behalf of the people of Leicester and Leicestershire for all the hard work that you and your teams do at Leicester hospitals. It really does make a huge difference, and I know so many people come in and out of those hospitals. They don't always have the opportunity to say thank you to you, because they might be unwell or they might be on a trolley temporarily, you might be just transferring onto a ward. But a big thank you to all the people who work in the NHS, particularly at Leicester Hospital. So thank you very much for coming in, and thank you for your efforts that you make for all the people of Leicester and Leicestershire. You're listening to Radio Ramadan, 87.7 FM. This is Our NHS, Our Health Show. I'll be back next week at 7 p.m. till 8 p.m. So I hope you're having a great